Thank you for joining Cancer Support Community Atlanta for the Tell Me More series. This program focuses on transplant options for multiple myeloma and is facilitated by Dr. Solh with the Blood and Marrow Transplant Group of Georgia. For information on other installments, please visit Cancer Support Community Atlanta's website at cscatlanta.org.
Hi, I am Melhem Solh, one of the physicians at the bone marrow transplant at Northside Hospital and the director of cellular therapy. I will be talking to you today about stem cell transplant or bone marrow transplant for multiple myeloma. Of course, it's unfortunate news to hear that you got diagnosed with multiple myeloma, but on the bright side, we have a lot of options and a lot of treatments, including transplant and cell therapy. And this is something we offer here at the BMT program at Northside. So typically when you get diagnosed with myeloma, your local oncologist, the first things they want to decide on, are you a transplant eligible or a transplant ineligible, which means, are you going to be somebody who will have transplant as part of their treatment, or are you going to be someone who will not get a transplant and will just stick with chemotherapy? And this decision is based on a lot of factors. Some of these factors have to do with your age, has to do with your comorbidities, what kind of medical problems do you have, and it also has to do with your functional status. So sometimes you might be young with not a whole lot of diseases going on, but you have a poor function because of the myeloma itself or of any other disease. So when we put all these things together, then we'll decide, are you a transplant eligible patient? And if that's the case, your oncologist who's going to start your treatment, and typically you can get 3 or 4 drugs to start with for a few weeks, you will be referred to a transplant program to be assessed for transplant eligibility. In your first visit to our center, you're going to have a long sit down with one of the transplant physicians. It's usually 60 to 90 minutes, where you will get evaluated to see, are you somebody who can handle this procedure and shall we move ahead with it? You'll also meet some of our team members, our coordinators, our mid-levels, our nurses. So you have a brief idea about what would your treatment entitle in the next few weeks. If we decided based on your disease, your age, your function, yes, we're going to offer you the transplant, you will come back for a full evaluation. And this evaluation would entitle scans, would entitle assessing your heart, your liver, your kidneys, would also take a look at your disease to see, have you been responding to the treatment you are getting closer to home or not. After this evaluation, which we refer to as a pre-transplant evaluation, you're going to have another sit down with your transplant physician to go over all this evaluation in details. And the reason you have that sit down, to be sure your workup came out okay. If there are any issues in any of your organs that needs to be fixed before you move ahead with the transplant, that will get addressed. You get referred to the right subspecialist, just to be sure you get a good workup and a good evaluation, that the goal is to get you through the transplant safely without any major complications. Now, moving on to transplant. Transplant itself that we do for multiple myeloma is called autologous stem cell transplantation. Autologous means your own. And stem cells, these are the cells that we're going to use for transplant. Now, the transplant itself is made of chemotherapy. It's a high dose of chemotherapy, and the drug we use is called melphalan. Now, melphalan is a drug that's been around for many, many years. We've used it for multiple myeloma. It's a very, very effective drug against multiple myeloma. And high doses of melphalan have very high response rates in multiple myeloma and can achieve full remissions in a significant number of patients, and these remissions can last for a long period of time. Now, one of the issues of melphalan, it is toxic to your bone marrow, and to be specific, it's toxic to your stem cells. These are the cells that we all have in our bone marrow, and their job is to make blood for us for the rest of our lives. So anytime you lose blood or you get low intensity of chemotherapy, your blood counts go down, your stem cells will go to work and replace that. Now, when we take you to do a transplant and we give you a high dose of melphalan, the chemo I mentioned, problem of this chemo, it can kill your stem cells. And if this drug kills your stem cells, then you won't be able to make blood again. So in order to be able to get you the transplant, we have to remove those stem cells out of the way, give you the chemo, and then we give you the stem cells back. So technically, all what the transplant entitles in this situation is moving your stem cells away to give you a high dose of chemotherapy and putting the stem cells back so they can go back to your marrow, regenerate, and make blood for you. Now, because this is your own stem cell, it's your own blood, you're not gonna reject them. These cells are not gonna attack your body or reject you. So it's a fairly safe procedure overall. Chances that anybody have major complications from transplant where they lose their life is usually well less than 5%. So most people are going to do okay with this kind of transplant. Now, once we've done the evaluation and we said, okay, you are cleared, we're going to go ahead with transplant, the first step is going to be collecting your stem cells. The way we do the stem cell collection is much easier nowadays than historically the way it's done. So now almost 99% of the patients, all we need to do is give you injections under the skin for a few days. And around day 5, you will come to the clinic. We will put a central line or a big line that goes to one of your big veins. And we connect you to a machine called the pheresis machine, similar to folks who get dialysis pretty much. The line is going to come out from under the skin. It has 2 lumens. Blood will come out from one lumen, goes through that machine. The machine will pick up your stem cells. Blood will come back to you. So this is usually painless procedure. You're in the clinic in a recliner chair for a few hours. If we collect enough cells in one session, great. If we need more, we do the same thing the next day till we have enough stem cells. And that's what we refer to as mobilization of stem cells or collection of stem cells. We collect such cells, then we can freeze them. And these cells can be frozen for a very long period of time, for several years. We freeze them in our stem cell lab. We're going to give you a couple days break after the collection. And then we're going to move ahead to the transplant. Now, the transplant itself starts with the chemotherapy that I mentioned. It's 1 dose of chemo that you get it over a few hours. And that chemo is called melphalan. Sometimes we'll have you chew on some ice while you're getting the drug just to help with some of the side effects. That happens over a couple hours. You get the chemo. The next day, we will give you back your stem cells that we collected. And that day, when you get your stem cells, is what we call day 0 or day of transplant. The way you get your stem cells is just a blood transfusion. It's a bag of blood that's going to go through that same line that we put in to collect your stem cells. So now what's going to happen, we start counting after day 0. We start saying day +1, day +2, day +3, and so on. So in the first couple of weeks after you've gotten your chemo, the chemo is going to kill the blood that was already in your system. So you're going to start seeing your blood counts going down. You see your white blood count go down to 0. You see your hemoglobin go down. You see your platelet count go down. And that drop takes about 10 to 14 days before the new stem cells can find your bone marrow and start making fresh blood for you again. When that happens, you start seeing all these blood counts coming back up, and that's when we say you engrafted or the transplant took over. Now, during this 14 days period, obviously you're going to be monitored very closely if you need blood transfusions, if you need platelet transfusions. We do have you on a bunch of antimicrobials to prevent infections. And we continue to follow up till we're sure everything is going well, everything has recovered, and so on. Now, this kind of transplant, autologous transplant at Northside, we can do this either outpatient or we can do it in the hospital. I mean, we always prefer outpatient. The patients always prefer to do it outside in the clinic because they can go back and forth home, sleep in their own bed. They recover faster in terms of their strength and so on. So when we do it outpatient, everything I mentioned will happen in the clinic. So you're coming for your chemo to the clinic and you go back. The next day is called day 0. You come in, you get your cells, and you leave the same day. And then we see you daily for about 3 weeks, including weekends, holidays, to be sure we're checking everything on a regular basis. Now, once you're fully recovered from the transplant, you're not having any issues. About 4 weeks down the road, we send you back to your local oncologist and we start meeting on what we call our anniversary visits at 3 months, 6 months, 1 year, 2 years, and so on, to keep an eye on your cancer, be sure things are going well, we don't have to restart any treatment. Now, if we choose to do it in the hospital, and very rarely we'd have to do that, and this will depend on the patient, honestly, if they want to get it done there or if they don't have a caregiver to do it in the clinic, then you'll go in the hospital and you spend about 3 weeks in the hospital to fully recover during your stay. Now, the main advantage of transplant is can get you in a deep remission. It can get you in a deep remission for a long period of time, and it can help you come off the consecutive treatment cycles that you will need if you're not on a transplant. So you can go on several years where all you need is what we call a maintenance after a transplant. That's a very low intensity of treatment. Go back to normal life, do your normal job, and so on. Now, transplant, as I mentioned, is not for everybody. It's definitely an option that will help with your disease control, helps with your outcomes. But this would be a decision made based on all the factors I mentioned early on. And you can always discuss it with your oncologist. All of them, they know about transplant and they will refer you to a transplant center closer to you. If you have any further questions and you want to look at further slides on multiple myeloma, be sure to reach for the free oncology support services that are available through Cancer Support Community Atlanta. And the website for that is cscatlanta.org. And thank you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.